Vertigo is an extreme sense of dizziness that can actually be bad enough to cause vomiting or the need to lay down because it feels like the world is just spinning around you. There are a lot of different causes of vertigo. Some of them are more serious, like a brain bleed, head trauma, brain tumor. We're not going to talk about those because obviously that represents less than 10% of all causes of vertigo, and that's not something that me as a chiropractor can help you with, okay? We're going to talk about the more common 90% of all causes of vertigo, okay? And the first one we have is actually medication side effects. So if you are on a new medication or you feel like you're on some certain medications that are interacting, talk to your prescribing doctor because that can cause some problems, okay? Next, in the world of chiropractic, we have migraines. Migraines are one of the most common causes of vertigo. Migraines are more so a blood flow related type headache. And so when I hear migraines or headaches, I always check C1, which is the very first vertebra in your neck. It's very close to your brainstem, and it actually can influence the blood flow to the brain. And so that's always the first place that we look, and chiropractic care has been shown to be very effective in treating migraines and migraine-caused vertigo. Next, we have something called Meniere's disease, which is one of those tricky things in the medical world where they don't know 100% why it happens, but it's chronic ringing in your ears or vertigo, and they think it has to do with the exchange of fluids from the inner ear. It actually drains down into part of your throat. So again, C1, its proximity to the tubes that drain can actually assist in drainage from the inner ear. So that's Meniere's disease. Lastly, we have something called BPPV, and it stands for benign paroxysmal positional vertigo. And that's why we use the acronym, because that's obviously a mouthful. Inside your inner ear, the system that allows you to maintain your balance is called your vestibular system. And you can see it's a weird piece of anatomy. It's kind of an odd shape, but there are those three semicircular canals, and they're oriented in different directions so that even if I close my eyes, as I move my head up, down, side to side and tilt, I can tell where my head is in space, and I can tell approximately how fast I'm moving because of that inner ear system. Inside those semicircular canals are fluid and something called otoliths. If those crystals, those otoliths, get out of position or stuck, they can cause misinformation to be sent from the ear into your brain, which makes your brain feel like you're moving even if you're not. The best thing to do for BPPV is actually see a vestibular specialist. They're usually physical therapists, and they can actually help you go through certain positions and movements to get those crystals and that fluid back where it all belongs so that you can stop that misinformation. Sometimes it's just a matter of time as well, of having your body reset and fix that just from normal day-to-day movements. So those are the most common causes of vertigo, which ones chiropractic can help with, and if you or anyone else has experienced vertigo, what might be causing it.